റോഡ് എന്ത് ട്രെയിൻ ഉണ്ടാവുമല്ലോ.
ലൈവ് സ്ട്രീമിംഗ് ഉണ്ട്. ഇന്ന് 200 പേരോളം രജിസ്റ്റർ ചെയ്തിട്ടുണ്ട്.
ലൈവ് സ്ട്രീമിംഗ് ഉണ്ടോ?
ലൈവ് സ്ട്രീമിംഗ് ഉണ്ട്. യൂട്യൂബ് കണക്ട് ചെയ്തോണ്ടിരിക്കുക ഞാൻ.
മറ്റേ ഗ്രൂപ്പിൽ അറൌണ്ട് 200 പാർട്ടിസിപ്പേഷൻ ആയിട്ടുണ്ട് ഗ്രൂപ്പിലെ.
യൂഷ്വലി അത്രയും വരാറുണ്ടോ യൂഷ്വലി?
ഇല്ല ഇല്ല
ഇല്ല, ഇതിന് നല്ല റെസ്പോൺസ് ആണ്.
ഇത് കാണാവോ? സ്ക്രീൻ കാണാവോ?
സ്ക്രീൻ കാണാം,
കുഴപ്പമില്ല. ഞാൻ നോക്കിക്കോട്ടെ.
നോക്കിക്കോ.
History has proven that those who directly imagine the impossible are the ones who break all the human limitations.
यस्यां समुद्र उत सिन्धुरापो यस्यामन्नं पृष्ठयः सम्बभूव यस्यामिदं जिन्वति प्राणदेय सा नो भूमिः पूर्वमे दधातु.
നമ്മുടെ റോഡിനെ കാണുന്നില്ലല്ലോ. എന്തോ റോഡിൽ വന്നായിരുന്നു. വന്നിച്ച് ഞാൻ അഡ്മിറ്റ് അടിച്ചു. വന്നിട്ട് പിന്നെ കേറി എന്നിട്ട് വന്നില്ല.
അല്ല സർ, അത് എന്റെ പേരിൽ വന്നതായിരുന്നു. അറിയാതെ എന്റെ പേരാണത്. ഞാൻ
കള്ളി.
ആൾക്കാർ ഓൾറെഡി ഗ്രൂപ്പിൽ നിൽക്കണമെന്ന് അല്ലേ?
ഇതെല്ലാം കാണാൻ പാടില്ലേ?
കാണാം സാറേ.
പ്രദീപ് എന്നെ ഇതാക്കിയിട്ടുണ്ടോ? കോഹോസ്റ്റ് ആക്കിയിട്ടുണ്ടോ?
കോഹോസ്റ്റ് ആക്കിയിട്ടുണ്ട്.
ഓക്കെ.
ഞാൻ റെക്കോർഡിംഗ് പോസ്റ്റ് ചെയ്ത് വെച്ചേക്കാം. ലൈവ് യൂട്യൂബിൽ പോയിട്ടുണ്ട്. ഞാൻ അതിന്റെ ലിങ്ക് ഞാൻ മുരളിക്ക് ഇപ്പം മെയിലിൽ അയച്ചിട്ടുണ്ട്. മുരളി അതൊന്ന് എടുത്തിട്ട് കോപ്പി ചെയ്തിട്ട് ഇതിനകത്തൊന്ന് ഇട്ടേക്കാവോ? നമ്മുടെ ഇതിനകത്ത് എന്താ പറയുന്നത്, നമ്മുടെ ഗ്രൂപ്പുകളിലും പിന്നെ എല്ലാ ഗ്രൂപ്പിലേക്കും ഇടാം, കുഴപ്പമില്ല. പക്ഷെ എനിക്ക് തോന്നുന്നത് ഇത് നമ്മുടെ ഈ സൂം ഫില്ലായിട്ട് നമ്മളത് റിലീസ് ചെയ്താൽ മതിയോ അതോ ഇപ്പോഴേ അങ്ങ് ചെയ്യണോ?
ഇപ്പോഴേ ചെയ്തേരെ സാറേ,
ഇപ്പോഴേ ചെയ്തേക്കാം അല്ലെ? എന്നാ ഇപ്പോഴേ ചെയ്തേക്കാം. ഓക്കെ.
ഏത് മെയിലിൽ അയച്ചാ പ്രദീപ?
യാഹൂ.
ഓക്കെ.
കണ്ടോ? കിട്ടിയില്ലേ?
കിട്ടി.
അതാ ബ്രോഷറൂടെ വെച്ചോണ്ടേ. കോപ്പി URL. ഞാനൊന്ന് ഇടാൻ നോക്കണോ? ഒന്നുകൂടി.
ഇട്ടോ, കുഴപ്പമില്ല.
ഓക്കെ.
ആരാ? ഈ വാചകം അടിച്ച് ഈ മതത്തുകാരുണ്ട് എണ്ണങ്ങളൊക്കെ
സാറേ കോളേജിലിരിക്കാണോ?
കോളേജിലാണെങ്കിൽ ഇത് 100 MBS സാധനമുണ്ട്, നെറ്റ് ഉണ്ട്, ഇലക്ട്രിസിറ്റി പോവില്ല.
അപ്പൊ ബാക്കപ്പ്.
അതെന്നാ പറയാ, ഈ മറ്റേ വീട്ടിലൊക്കെ ആകുമ്പോഴത്തെ ജനറേറ്റർ ആണെങ്കിലും ഈ ബ്രോഡ്ബാൻഡ് ആണെങ്കിലും ചിലപ്പോ ഈ സ്ട്രെങ്ത് കുറയും. വൈകുന്നേരം ആകുമ്പോ നല്ല യൂട്ടിലിറ്റി കൂടൂലേ. റിസ്ക്. സാരമില്ല, ബ്ലോക്ക് ചെയ്ത് വെച്ചേക്ക. ഞാൻ എപ്പോ പറയട്ടോ.
വിളിക്കണോ? കേറാൻ പറയണോ?
റോണി വന്നു.
ഓക്കെ. യൂട്യൂബ് ലൈവിന്റെ സിമ്പിൾ വന്നല്ലോ.
യൂട്യൂബിൽ ലൈവ് ആയില്ലേ?
ആയി തോന്നുന്നു.
എനിക്ക് ഞാൻ അപ്പുറത്തതിനകത്ത് ഞാൻ എന്റെ ഈ ഒരു ഫോണിനകത്ത് എനിക്ക് പോവാം. എന്നാലേ അതിനകത്ത് എത്ര പേര് കയറി എന്നുള്ള അറിയാൻ പറ്റും.
8 മണിയാകുമ്പോ കയറ്റിയാ മതി.
അതെ. അല്ല പക്ഷെ ഇപ്പൊ ലിങ്ക്
ആൾക്കാരിവിടെ സംസാരിക്കുന്ന കൂടെ കാണുമല്ലോ.
യൂട്യൂബിൽ ഇനി എല്ലാം ലൈവ് ആയിരിക്കും, അതുകൊണ്ട് എല്ലാം കാണാനാണ്.
റോണിങ് കയറിയിട്ടുണ്ടല്ലോ.
കേക്കാമോ?
കേക്കണ്ട്.
കാണണ്ടോ നോക്കട്ടെ, ഒരു മിനിറ്റ്. കാണാമോ?
ലുക്കിംഗ് ഫോർ ദ ഫോൺ ആണ്.
നിക്ക് അയ്യോ പണിപാട്. ഒരു മിനിറ്റ്.
Looking for the phone? What is this, Mr. CD Chairperson?
അത് വേണമെങ്കിൽ നമുക്ക് ഫോണിൽ നിന്നും കാണാവുന്ന സെറ്റപ്പ് ഉണ്ട്. ഇപ്പൊ കുഴപ്പം ശരിയായില്ലേ?
ശരി.
ഓക്കെ. സൗണ്ടാ
പറഞ്ഞ ലൈവ് പോകണ്ട കേട്ടോ.
കഴിഞ്ഞ എനിക്ക് മൊത്തം പറ്റിയതാ, ഒന്നും പറയുന്നില്ല. ഓക്കെ.
റോണിനെ ബെന്യാമിൻ സാറിന്റെ അടുത്ത് അയച്ചു കൊടുത്തായിരുന്നോ ലിങ്ക്?
ലിങ്ക് അയച്ചായിരുന്നു, കണ്ടോന്ന് എനിക്ക് അറിഞ്ഞൂടാ. മെസ്സേജ് അയച്ചിട്ടുണ്ടേ.
ഗ്രൂപ്പിൽ അറൌണ്ട് 200 മെമ്പേഴ്സ് ഉണ്ട് കേട്ടോ.
എന്നെ ഉണ്ടാവൂലോ. ഒരു മിനിറ്റ്.
മറ്റേ വെബിനാർ മാത്രമുള്ള സംഭവങ്ങൾ ചെയ്തു നോക്കാം അല്ലെ?
അതെ.
അതില് പാർട്ടിസിപ്പേഷൻ ലിമിറ്റ് വല്ലതും ഉണ്ടോ? അങ്ങനെ വല്ലതും ഉണ്ടോ?
ഞാൻ നോക്കിയിട്ടില്ല മുരളി. അല്ല എന്തായാലും 100 ഉണ്ടാവുമല്ലോ.
വെബിനാർ ഇതിലാണെങ്കിൽ പാർട്ടിസിപ്പൻസിന്റെ പ്രശ്നം വരുന്നില്ലല്ലോ, ആരും ജോയിൻ ചെയ്യുന്നില്ല ഇതുപോലെ.
അതെ.
1 വേ ട്രാഫിക് അല്ലേ ഉള്ളൂ.
അതെ.
ഞാൻ പറഞ്ഞ ക്ലിയർ ആണോ പ്രദീപ്?
ഏതാ
ഞാൻ പറഞ്ഞത് ക്ലിയർ ആവുന്നുണ്ടോ?
ക്ലിയറാ. ഒരു ചെറിയ എക്കോ ഉണ്ടെന്നുള്ളതേ ഉള്ളൂ.
ഓക്കെ. അപ്പൊ റൂമിന്റെ എക്കോ ആയിരിക്കും. ലൈവ് ഉണ്ട്.
മുരളി സാറേ, വരുന്നവരെയൊക്കെ ഇപ്പൊ അഡ്മിറ്റ് ചെയ്യണോ? അത് എന്താ ചെയ്യേണ്ടത് സാറേ? മ്യൂട്ടാ.
ഒരു 8 o'clock തൊട്ട് മുമ്പായിട്ട് ചെയ്താൽ മതി.
7:51 ആയേ.
ഒരു 7:55 കഴിയുമ്പോഴത്തേക്കും അഡ്മിറ്റ് ചെയ്ത് തുടങ്ങിയാൽ മതി.
ശരി, ഓക്കെ.
പ്രദീപ് സാറേ ഇടയ്ക്ക് ഒരു ടിങ് എന്നൊരു സൗണ്ട് ഉണ്ടല്ലോ, അതങ്ങ് ഓഫ് ചെയ്യാൻ പറ്റി ഓഫ് ചെയ്തേരെ.
അത് തുടങ്ങുമ്പോഴത്തേക്ക് ഓഫ് ചെയ്താൽ പോരെ?
അത് മതി അത് മതി. ഓക്കെ.
യൂട്യൂബ് ലിങ്കിലാണ് ആൾക്കാർ കൂടുതൽ കയറിയുന്നത്.
നമുക്കെന്നാ അക്സെപ്റ്റ് ചെയ്ത് തുടങ്ങിയാലോ?
അക്സെപ്റ്റ് ചെയ്ത പ്രതിഭ
ആ
ചെയ്തോളാം. ഒന്നുകൂടെ ലിങ്ക് ഒന്ന് വേണമെങ്കിൽ ഒന്നുകൂടെ ഇട്ടേ കേട്ടോ. എന്ന് വെച്ച് കഴിഞ്ഞാൽ ഓൾറെഡി അത് യൂട്യൂബ് ലിങ്കാ നിൽക്കണത്. ക്ലിക്ക് ചെയ്യുമ്പോൾ നേരെ യൂട്യൂബ് ലിങ്കിലേക്ക് പോകും.
ജിജു സാറിന്റെ പടം വന്നില്ലല്ലോ.
ജിജു സാർ ഇവിടെ ഉണ്ടായിരുന്നു.
ആ തകർത്തു.
പ്രതിഭ
മുരളി 8 o'clock ആയി, നമുക്ക് സ്റ്റാർട്ട് ചെയ്യാം. 83 ആയി. ഹലോ മുരളി, കേൾക്കാമോ?
പ്രദീപ് സാറെ ആ സൂം ലിങ്ക് ഒന്ന് അയച്ചു തരണേ.
കേൾക്കണ്ടേ പ്രദീപ്? കേൾക്കാം. നമുക്ക് സ്റ്റാർട്ട് ചെയ്താലോ? സ്റ്റാർട്ട് ചെയ്യാം. കേൾക്കണ്ടോ പ്രദീപ്?
യെസ് യെസ്.
സ്റ്റാർട്ട് ചെയ്താലോ? Good evening, everyone. I am Dr. Murali Krishna, President of IDEA Malanadu. Secretary, Dr. Pradeep Philip George. Speaker of the day, Dr. Jiju George Baby. CD Chairman, Dr. Ronin Sebastian. Management of Anu Dental College. Dear Malanadu members and members from other branches. We cordially invite you all for the webinar on pharma rhythm. This is a very interesting topic, and congratulations to our CD Chairman, Dr. Ronin Sebastian, for choosing the topic. We are using various drugs in our daily practice, like antibiotics, analgesics, mouthwashes, ointments, and anxiolytics, etc. Today's session is based on the clinical pharmacotherapy for treating illness based on the endogenous biological rhythm, and gives emphasis on circadian clock and factors affecting the normal biological clock. It also throws light on influence of biological rhythm on drug administration, which is very important to curb the incidence of drug resistance. Hope everyone gets enlightened by our wonderful speaker, Dr. Jiju. With these few words, I welcome once again all of you to the webinar. Thank you. Now to introduce our speaker, I call upon our CD Chairman, Dr. Ronin Sebastian.
One tree can start a forest. One word can frame a goal, and a true leader has the confidence to stand unique. The brave decision maker and a team leader, Dr. Jiju George Baby. He completed both his BDS and MDS in oral and maxillofacial radiology from A.B. Shetty Memorial Institute of Dental Science, Mangalore. Dr. Jiju George Baby is an organized professional with proven teaching, guidance, and counseling skills. He was the vice principal and principal in charge of Mar Basilius Dental College, Kodamangalam from 2002 to 2012. Presently, from 2018 onwards, he is the principal of Anu Dental College and Hospital, Moyatuda. He also has been instrumental in all Anu accolades. To pin, Sar has been the backbone for taking Anu to the present height as the best dental college in Kerala in self-financing sector in the year 2019, as per the survey by Higher Education Review magazine, and as the 22nd among all the private dental colleges in India in 2020 by the Week magazine, and the latest L'Oreal being the NAC accreditation with the highest grade for a single dental education institution in India. He has numerous national and international awards in his credit. He got Best Poster in National Microbiology Conference in the year 1999. During his term as the president of IDEA Malanadu branch, he bagged the National Best President Award in the year 2012. He was the recipient of the Best Principal Award by Global Society of Health and Education. I welcome you, sir. The stage is all yours.
Thank you, Ronin, for a wonderful introduction. Hope I can live up to your expectation. So let me share my screen. Ronnie, visibility and audibility is okay, I feel.
Yes, sir, you are. Your visibility is fine as well as your audibility also.
Okay, thank you. Thank you all. Okay. Now, let's start the story which has happened long back. So it is 550 BC to 479 BC, happened in China. Confucius was known to be the first Eastern philosopher. And more than a philosophy, he was a teacher, he was a scholar, he was a writer, he was a poet, and he was a politician also. See, that time, university was not formed like this. Okay, disciples used to go to him for learning. So, and his thought process were so revolutionary that his thought process used to annoy the youngsters. That happens always when you come with a new program. So definitely there is going to be resistance. One day, so the students decided to test the caliber of their teacher. So what they did was they carried a small bird, very small bird in their hand, and took it to the master and asked him, "Master, just tell us whether this bird is live or not." He understood the trick. So if he says the bird is live, they will crush the bird and they'll show a dead bird. And if he says alive, dead means definitely they'll show a live bird. He thought for a while and he answered quite brilliantly. That answer echoed into eternity, and it echoes till now. What he told was, see, my dear children, the life of that bird is in your own hands. Same way, life of this profession, the future of this medical profession is in our hands, because we are the practicing medical professionals. And as a quality citizens of the society, quality imparting of the treatment is our responsibility, our prime responsibility. So thank you very much for the very kind introduction. I belong to Anu family, Anu Dental College, Muatuvira. We are very humble and simple people. We had a humble beginning, but the perfect teamwork from management to the CPA group has given us a lot of accolades. Just quickly, I'll just run through this, because last year we were accredited with a NAC, that too with B++, which is the highest among the all standalone dental colleges in India. And we were the 6th college in India to receive NAC accreditation in the new format. And 2021-20, we were ranked 22nd among all the dental colleges in India by the prestigious magazine Week. And 2019, we were the college of the year in the entire country for the overall activities. I'll just quickly take you to my college with a short video presentation.
History has proven that those who dare to imagine the impossible are the ones who break all the human limitations.
यस्यां समुद्र उत सिन्धुरावो यस्यामन्नं पृष्ठयः सम्बभूव यस्यामिदं जिन्वति प्राणदेय सा नो भूमिः पूर्वे दधातु.
So coming to today's topic, pharma rhythms. So we are discussing the body rhythms, as well as we are going to discuss a little bit pharmacology and the lifestyle and the changes we need to make for the better future. Okay. So we start with a case from my world. This has happened in 2007. So the patient was referred to me by one of my students from Madimali. So 50-year-old plus female, maybe she's very thin, very lean. She has lost a lot of weight for the past 6 months. she was having bilateral ulcerations of the buccal mucosa. It was so painful, she couldn't eat anything, and she has lost a lot of weight. Luckily, she was non-diabetic. And she was really worried about whether it is a cancer or not, what is going to happen, because she has visited so many doctors and nothing worked out. Finally, she came to us. So the diagnosis was quite easy. We made the diagnosis as erosive lichen planus. Okay, maybe the most aggressive pattern. So we thought we'll start with a systemic steroids, because that is a first line of treatment for a severe erosive lichen planus. And since the patient was very thin, lean, and she couldn't eat anything, where like she was having severe gastritis, we thought we'll start with the 20 mg prednisolone. But we thought since the patient can't eat much, so we decided to divide the dose into 10 mg BD. And along with an antacid, we mixed and given to the patient. We console the patient, everything will be okay. You will be fine, and send the patient back. And to our surprise, and for the worst scenario, 4th day, the patient came back. And the patient was really furious because she has lost all the orientation, and the disease still remained there just like that. Because if it was erosive lichen planus, definitely there should have been a little bit reduction. Then this was taken us back for a lot. So then the brainstorming was done with the different departments. And finally, we decided to make only one change. Instead of 10 mg BD, we decided to give the patient 20 mg OD immediately after the breakfast by 10 a.m. And antacid was given. Somehow we convinced the patient, somehow we convinced the bystander, and the patient was sent back. Just see the sharp cost for 3-4. We couldn't reduce this because the patient was so painful. See, patient couldn't open the mouth. Okay, and after a week, patient came back like this. All the symptoms almost subsided. Lesion was still there. And we could do the coronoplasty of 3-4, and the patient is still alive, and the patient is followed up by quite nicely. Only one change we made. Instead of 10 mg BD, we just gave 20 mg OD, which made huge difference. Why? This we'll discuss later in this topic. Okay. And for our normal body functions, we don't need a clock. You talk about hunger. Okay, I'm just talking about normal persons, normal personalities, normal brain, and a normal working class. I'm just talking about. You have got a time to get up. You have to you got a time to go for your work. You have time to eat. You have to time to sleep, and you have to do time for all the works which you know. But for that, you don't need a clock, basically. A famous quote goes like this: for everything there is a time. There is a time for monsoon. There's a time for summer. There's a time for winter. There's a time for autumn, and the time to plant the seeds, especially our cultivation, agriculture, everything got a time. Otherwise, it won't sprout. The perfect example is going to be the red Panjim beach in China. See, during this mid-September to mid-October, the entire beach looks red because of the maybe a sprout or maybe flowering of the red salsa plant. That happens only during the mid-September to mid-October. So mean to say that, so there is, for everything, there's a time. So the chronopharmacology means treating the illness according to the endogenous biological rhythms. So you take any life of this planet, whether it is a plant, whether it's an animal, or maybe a single cell amoeba or a human being, there is no life without a rhythm. Definitely there is a rhythm, which can be altered, but definitely there is a rhythm for everything. Just see this, one of my friend Naveen is an IT professional. So definitely entire day he has to toil, night he has to do the babysitting. So whenever our relatives give birth to a newborn baby, definitely we ask, do you sleep in the night? We'll ask the mother, So why? Because this biological clock is not set. Baby doesn't know when to get up, when to sleep. Only thing is that he knows that when the person that baby is hungry, he cries. So when the biological clock is set, everything comes to normal. This biological clock is set according to the seed-givers factors. Seed-givers factors mean to say that bright light, social factors like warmth, care, love, affection, touch. Then the pigments known as melatonin or melanopsin, food, exercise, everything is fed to the baby for a long time, 2, 3, 4, 5 weeks. Automatically, the baby's rhythm or a human being's rhythm, biological clock is going to be set. See, I said the input is going to be the chemical and physical factors, light and social factors like warmth, love, care, affection, everything. And once the clock is set, the output is going to be the body activity, body temperature, and output of the hormones of the body. We have got n number of body rhythms. We'll discuss 3, and mainly we'll concentrate on 2 out of it. The first is circadian rhythms. Circadian rhythm means to say that what happens in every 24 hours, means to say that 6 a.m. to 6 a.m. Infradian rhythm means more than 24 hours, just like menstrual cycle. And ultradian rhythm means multiple times in a day, like hunger, thirst. Okay, we are really bothered about circadian and infradian rhythms of the normal human beings. Understand like this. By 6 a.m., we are supposed to get up by that time. And when the eyes retina is subjected to the blue light, the blue daylight, retina produces a pigment known as melanopsin. This activates the master clock, which is known as suprachiasmatic clock, suprachiasmatic nucleus, which produces serotonin and dopamine, which activates the entire body systems. All the systems are awake and activated by this melanopsin pigment, which is activated, which is produced from the retina when the retina is subjected to the daylight, the blue spectrum of light. Same way, by 6 p.m., when the retina is subjected to yellow spectrum, the night light, the pineal gland produces a pigment known as melatonin, which puts the body to rest. We need activation and we need rest also, which is for the normal body functioning. I'll take you to a case which has happened in this pandemic. Very interesting case. 16-year-old boy from a very affluent family. The person was a very studious boy. He was having skin lesions and frequent mouth ulcerations. Skin lesion used to happen when he is subjected to sunlight. All this thing happened around 2020, September, October time. So pandemic, see, they have visited multiple senior doctors, physicians, and everyone. Finally, the case was referred to me for the frequent oral ulceration. I thought it's a job on hand because so many seniors have seen this case and they might have done all the investigations possible. Anyway, I thought I couldn't refuse because one of my relatives, so definitely I couldn't refuse this case also. So what I did was I took the history by word to word. I took the symptoms by centimeter to centimeter and I reviewed every systems. I looked into every other blood report which he had. So finally we came to, and we had in our department, we had the brainstorming also. And finally we came to the 3 conclusions. The first thing is that his biological clock was altered. The first thing, during the pandemic, he used to get up at 8:30, 9, 9:30, 10:30, 11, 12. Usually before pandemic, when we used to go to school, he used to get up at 6 or 6:15 because 7:30, 7:45 his bus used to come. But now in pandemic, and if the parents leave early, this fellow used to sleep till 11:30. The second thing is that he changed his food style or maybe timing. He used to take his breakfast by 12:31, lunch by 4:35, dinner by 10:30, 11, and he used to sleep late in the night. And the third and the most crucial point was he used to use mobile in the night. And his parents used to go to sleep by 10:30, 11, and he used to switch off the ambient light and he used to play in the mobile. And this made the problem because mobile screen belonged to blue spectrum. Melanopsin was active. Where the melatonin is supposed to be there, melanopsin was active, biological clock got changed, digestion, everything got changed. Finally, those people were in real trouble because we convinced the parents, convinced the patient also, he was willing. So what they did was, parents said that 1 week we will sit my mother will sit, the second week parent will sit, so father will sit. Same way that they made him to wake up early before 7. They made him to take breakfast before 8 a.m., lunch between 1 to 2, and he took dinner before 8 p.m. And after 8 p.m., mobile was not given. And he was put on a soft diet, antioxidant, and we asked him to do a little bit exercise also. Within a month's time, biological shifted to normal cycle, and both the lesion disappeared. Both the lesion disappeared. So this was an eye-opener for the biological rhythms. See, that's why the entire topic was framed like this. Okay, we discussed about 2 pigments, melanopsin, blue light, retina, pigment, activates the entire body. Then second is yellow light, night, 6 p.m. and it puts the body to rest. Melatonin puts the body to rest. We need the synergism of these 2 pigments for the normal functioning of the body. Okay. I just put this picture for one special reason. Just see the second last one, cool white LED. It belongs to the blue spectrum. frequency is less and intensity is really high. It has the intensity of the same daylight, and our mobile screens belong to cool white LEDs. I don't say that you are not supposed to use mobile at the night. If you are using it, please use it in a power saving mode. Please use it. Make sure that you use it in an eye comfort zone mode. And after 9, please, it is totally contraindicated. If it is possible, please don't use mobiles in the night. Emergency for 1 or 2 minutes you can use, but for a continuous use, it is totally contraindicated, because if it belongs to blue spectrum, melanopsin production, melatonin will go down, so your body doesn't get rest. So definitely the biological clock is going to alter. Now let's see what are the peak biological functions of our body. The first thing, 6 a.m. blue spectrum. The metabolism starts to run. Body systems are awake, and there's a sharp rise in BP because there's a peak hormonal level as well as a peak cortisol level between 7 to 9 a.m. And the body is less sensitive to pain due to the production of the endogenous endorphins as well as endogenous opioids. And because of platelet aggregation and vasoconstriction, there's a high chance of less bleeding. Maybe bleeding might be very less during the morning time. And because of all these hormones and the steroid input, the body has the highest alertness between 10 to 12 noon. When we were studying, schools used to start by 10. My age, definitely people remember that, because of the biological system, our body has the maximum attention, maximum care at 10 a.m. That's why school used to start at that time. The maximum gastric acid secretion happens between 1 to 2 p.m. So that time you get the best digestion, and you must take lunch during that time. And when you have a good lunch, definitely it's a time for nap. And 5 to 6, your muscle performance peaks. So that is a playing time. The school was set accordingly, because earlier it was 10 to 4 and 5 to 6, it was playing time for everyone. By 6 p.m., melanopsin reduces and melatonin increases. Body is put to rest, body cools down, and the body relaxes. And by 10 p.m., the bowel movements and peristaltic movements are suppressed. That's why people say, all scholars say that you're not supposed to have dinner after 10, maybe after 8. And at 2 a.m., we all know that we will be at the deep sleep, and the lungs are most active between 4 to 6. That's why Yogi says that you have to get up at the early morning so that you'll have maximum inhalation of oxygen, so that the brain works really high. And by 6 a.m., again, the melatonin secretion starts. So this is again, the metabolism rises, and there is a sharp rise in BP by 6 a.m. 7 to 9, you have got the peak hormone level at cortisol level. 8 to 11, you have got less sensitivity towards a pain. That's the best time for surgeries, because 2 things, less pain as well as less bleeding. And 10 to 12, you have got this is a high alertness time. Okay, rest all we discussed. Now let's go to the disease rhythms. Hypertension, epileptic seizures, and stroke. That is because of the peripheral vasoconstriction as well as the platelet aggregation. The patient is prone to hypertension, epileptic seizures, and stroke in the early morning time. And acute MI, again, due to vasoconstriction as well as the platelet aggregation. And if you have got an ulcer, see, during the maximum gastric acid secretion time, that is 1 to 2, you have got bleeding of the ulcers. And by 6 p.m., melatonin starts, the endogenous endorphins as well as opioid reduces. So you have got high chance of increase in chronic pain, joint pains, chronic pains, and cancer pain. Everything increases in the night. And the ulcer, the peristaltic movement goes less. Whatever ulcer, whatever acid is produced remains there. So definitely, if you have got a duodenal ulcer, the pain peaks during the night time. And please do understand this one, Prince metal angina. That is a silent angina, variant angina, because of the vasospasm which happens in the early morning by 2 to 4 a.m. There is a high chance of Prince metal angina. We all heard that somebody had silent attack in the night in the sleep and he died. So that is Prince metal angina, because of vasospasm, coronary vasospasm may predispose, and the prone people may have cardiac arrest in the night. That is the silent attacks. And asthma and allergic rhinitis peaks between 4 to 6 a.m. because of the excessive production of cytokines as well as the inflammatory mediators. Inflammatory mediators and cytokines are largely produced during 4 to 6 a.m. That's why the person is prone to asthma. The asthmatic person will get the severe attack during this time. Okay. Now, when we know the body rhythms, when you know the disease rhythms, it is quite easy for us to treat. So this is to prevent the overdosing, the first thing. Second thing is that the efficacy is increased. And you have to make sure that the drug should be available when it is greater needed. And with this, by checking to all these things, definitely we maximizes the therapeutic outcomes and minimizes the side effects. Now, the first case, systemic steroid. This has happened to my son also. That's why I'll discuss it later during the discussion time. See, normally 8 to 9 a.m., your cortisol level, the normal steroid production, which is required for the normal body function, happens between 8 to 9 a.m. And slowly by 10 a.m., it reduces and HPA axis suppression happens towards the night. And the very next day, because of the suppression, because of the body's requirement, the next day morning, again, the steroid, the input happens, which is required for the normal body function. If you give a systemic steroid in the night, the HPA axis suppression doesn't happen. So the normal cortisol production for the normal body function doesn't happen. So if you give for 1 or 2 days, it's fine. The patient had anaphylaxis or delayed allergic reaction or severe allergic rhinitis, severe asthma, they go definitely to save life, you have to give it. 1 or 2 days, it's fine. Maximum a week, it's fine. But if you give more than a week, if it is systemic steroids, you have to alter the drug administration. You must give it by 10 a.m. This increases efficacy and doesn't cause much deleterious effects. Okay. That's why the first case, and already patient was worried. This because the psychological upset also happened because of the excessive steroid in the blood. So the patient was really furious on the second day. But when we give MD administered towards in the morning, everything subsided and patient calmed down and everything was okay. Second is hypertension. Hypertensive, chronic hypertensive cases, we have got two types of people. The first is known as dippers and second group is known as non-dippers. Dippers mean to say that their BP falls in the night. Non-dippers BP remains throughout the same, remains high throughout, night or daytime remains high. See, now the practice has changed. See, when I was studying, the surgery used to happen in the early morning. Now it has changed. It may happen according to the surgeon. So it may happen in the morning, evening, night, or maybe in the early morning also. Many times what happens is that the person comes and the patient will tell you that, doctor, I forgot to take my BP's medicine. Can I take now? Anyway, you're going to do a surgery or extraction. Can I take now? See, this is a tricky situation. You have to diagnose whether the person is a dipper or non-dipper. You are going to do an impaction in the evening. And if the person is a dipper, the patient has forgot to take the tablet in the morning. And if he takes in the evening, definitely he's going to go for a syncope. His BP is going to fall. You may face a big crisis in your clinic. That we have to make sure that whether the person is a dipper or non-dipper. Dipper means the drug, antihypertensive drug will be only in the morning. Non-dipper means BD administration will be there. If you see the regime of the cardiologist, if he has given BD, definitely is a non-dipper. Okay, so you have to make sure that these factors are considered before doing any surgery. Before going to the diabetes mellitus, let's see the peak level of sugar, blood sugar in our body. The first thing is at 8 p.m. Just see the graph, 8 p.m. it peaks normal. Whether you take food, you don't take food, it is going to peak because the body is going to utilize the things out there. Like glucose is produced because of the gluconeogenesis from the body, and the peak sugar level happens by 8 p.m. Same way, 8 a.m. it peaks. And the third time is going to be 2 p.m. That's why the second reason, like the scholars say that you should take dinner before 8 so that you have a good digestion. Before 8 p.m. because you have got a good digestion and from your food, the body uses the blood sugar. Okay, otherwise the sugar level is going to remain high for a long time. So that should not be happening because if you do it for a long time, you are prone to diabetes mellitus. Same way, before 8, everybody must take the breakfast. Before 8 a.m., everybody must take the breakfast. Whether you take breakfast or not, the blood sugar is going to peak. The third thing is that 2 p.m. again it peaks. You must take lunch before 2 p.m. You must take lunch before 2 p.m. Okay. So coming to diabetes, you have got again two types of chronic diabetes cases. The first is known as Somyogi effect. Somyogi effect mean to say that night that blood sugar level drops. Morning, because of the maybe the cortisol, the sugar level is going to be really high. Night it drops. So these kind of persons are not supposed to take anti-hyperglycemic drugs in the night, and they are supposed to take a carbohydrate diet before sleeping to maintain the sugar level. And the second group, it is known as non-dippers. So that is known as dawn phenomenon, where their blood sugar is going to remain for a long time as high. For these people, kind of people, you have to give anti-hyperglycemics in the mornings as well as the evenings. These kind of people are not supposed to take carbohydrate dinner before sleeping, because anyway, their blood sugar is going to be high. See, these kind of people, if the insulin productions are not there, you can use an insulin pump to maintain the proper blood sugar. Okay. The fourth one is going to be angina pectoris. May be painful for many of us, because many of our relatives might have this one. Somebody might have lost life also. Be careful about this, I tell you. In short, we have got three types of anginas. The first is going to be stable angina. Second is known as unstable angina. Stable means due to physical or emotional exertion, and somebody may be having chest pain. Okay, this unstable angina may be due to the superimposition of thrombus in the coronary vessels you will have. So this mainly happens during the vasoconstriction, platelet aggregation, that is between 8 a.m. to 12 noon. But the third variety, which is known as Prince metal angina, happens in the night by 2 a.m. Because 2 a.m. you have this vasovagal, what is that? The peripheral vasoconstriction which happens. So that time, if the person is susceptible to angina, he can undergo, he can have a cardiac arrest. Definitely, he is going to die that time. So, according to the disease, you have to give the medicine, whether it is a nitroglycerin, whether it is anticoagulant, which is required for the treatment as a treatment. It must be available. The person who are susceptible to stable and unstable angina, the person should have medicines, availability of the medicine in the blood in the mornings. Whereas the person who is susceptible to variant angina, the drugs must be available in the early morning by 2 a.m. so that the person is safe. That's why the doctors, cardiologists give whether it is aspirin or anticoagulants, whether it's in the afternoon or by evening, as a sustained release tablet, so that entire night and early morning the drug is available. That prevents cardiac arrest. Fifth is hypercholesteremia. 40 plus, nowadays you can expect everyone to have hypercholesteremia. Out of 10 patients, you will have 5 patients with hypercholesteremia above 40 years. The statins, the atorvastatin, rosuvastatin, all the statins are the real, the drug of choice for hypercholesteremia. They act by enzyme, which is known as HMG-CoA. HMG-CoA is active in the night. So if you are supposed to have, take an anti-cholesteremic drug, definitely you must be taking in the night, because it has got the highest activity in the night. If you take in the morning, the effectivity is going to be very less. So if you are taking a medicine for hypercholesteremia, it must be taken in the night. Asthma. I got a personal experience in the previous college also, which I don't want to discuss, but please do understand that. See, asthma peaks between 4 to 6 a.m. because there is the excessive production of inflammatory mediators as well as cytokines. So this mainly happens between 4 to 6 a.m. So if you take a one dose of corticosteroid in the 4 a.m., which is similar to multiple doses in a day. So for the person who is prone for asthma, the person thinks that I'm going to have an asthmatic attack. So always better he takes a puff early in the morning by 4 a.m. So it prevents asthmatic attack. So one puff at 4 a.m. is equal to as effective as 4 doses per day. Seventh one, cancer. So this is for your information. Cancer has got 2 aspects. The first thing is that pain. Second thing is going to be the chemotherapy. In a normal person, the DNA synthesis mainly happens in the daytime. But cancer cell multiplies, the S phase which happens in the midnight. So if you are taking a treatment for cancer as a chemotherapeutic agent, definitely it must be administered in the night for the better efficacy. The second thing is pain, because by evening, due to the production of melatonin, endorphins as well as endogenous opioids reduces. So you have to support the patient with opioids to relieve the cancer pain. So chemotherapy as well as opioids for the pain must be administered in the night. Same way like asthma, allergic rhinitis also happens in the morning because of the severe inflammatory mediators. The treatment of choice is definitely going to be antihistamine, and you have to take antihistamine in the night as a sustained release tablet so that by 4 to 6 a.m. it is available in the blood so that the inflammatory mediators are produced in a very little quantity. Again, this is for all of us. Forget about patients. This is for all of us. Gastritis. See, by 8 p.m., the peristaltic movement and the bowel movements are going to reduce. And whatever acid is going to be produced by the time, it is going to remain there. It used to cause severe pain, severe gastritis. And if you have got the duodenal ulcer, it is going to aggravate. We use two drugs, mainly two groups of drugs for gastritis. The first is H2 blockers like ranitidine. Then the second group is known as proton pump inhibitors. That is like your pantoprazole, omeprazole and all. See, H2 blockers act immediately in the stomach. Ranitidine acts in the stomach. If you want to have an immediate effect, give ranitidine. And proton pump inhibitors work in the duodenum. If you take a drug to reach duodenum from the stomach, it takes minimum 1 to 2 hours. So you won't have immediate effect. If you want to have effect with your proton pump inhibitors, you're supposed to give minimum 1 to 2 hours before the intake of the food and medicine. Then only you will have the better efficacy. Mean to say that you are giving an antibiotic, the person must be given an antacid. So what you should do is that first you should give a proton pump, a pantoprazole in the empty stomach. After 1 to 2 hours, you can take food. The patient can take food, and after that, the patient can take the antibiotics. So that reduces the gastritic pain. So this is sarcasm actually. If you want to have pain, please eat in the night. You can eat it in the night. The food after 8 p.m. is totally contraindicated. Okay, once in a blue moon you can have, there's no problem. But if you take constantly and by habit, if you take, definitely you are going to have gastritis and other problems. Please don't take dinner after 8. So try to finish your dinner before 8 p.m. Coming to antiplatelets. So we discussed that. So we discussed about the stable, unstable, anginas, and all those terms will be discussed. And aspirins are the antiplatelets. It's a first line of treatment. Those who are prone to this anginas, you give. So what happens is that if platelets are given, platelets should be available in the night and the early mornings. So if you are giving in the afternoon or in the evening, you are supposed to give sustained release tablet so that it is available in the blood. NSAIDs doesn't have much indications. See, please, but NSAIDs are better absorbed during the acidic phase. That is the morning and lunchtime, maybe that time. Till noon time, your real acid production is there. That time, NSAIDs are better absorbed. See, in chronic pain cases, some patient may have to take NSAIDs. So those cases, you have to reduce the dose, we have to increase the efficacy. Those kind of patients, TMJ pain cases and joint pain cases, you can tell the patient it's always better you take a morning or by noon, so that you take a sustained release tablet so that you have better absorption, better effects, so that the kidney damages and the gastritic damage is prevented. So next is antibiotics. Antibiotic itself is a big topic, one-day topic. I'm not going to discuss detail in this, but I'll give you a few tips on this. Fever due to common cold increases by 4 p.m. If you have got a bacterial infection associated fever, that increases in the evening. And if you have got a fever due to viral infection, increases in the morning. Morning fever and the prodromal symptoms, it is a typical feature of viral infections. And aminoglycoside, the gentamicin group, has got nephrotoxicity. If in a severe infection where you have to give cefotaxime, you have to give metronidazole, and if you have to mix the gentamicin along with that, especially in case of Ludwig's angina and all, you try to rectify the dose or minimize the dose with a single dose so that the nephrotoxicity is prevented. You know what? Last 25 years, no new antibiotic molecule has been discovered. 2050, all the medical field is going to face a problem, antibiotic resistance. This happens mainly because of us. and maybe a few quacks also. See, when you use antibiotics, it is our responsibility to make sure that you give the correct drug, correct dose, correct time, and correct duration. There is no 1 day, there is no 2 day, no 3 day, minimum 5 days you have to give. See, if it is an anterior infection, maxillary-mandibular anterior infection, broad spectrum aerobic is enough. But if you are going for a periapical infection, or especially with a pus in the posterior area, you are supposed to mix an anaerobic antibiotic along, so that the excess dose of the aerobic antibiotic can be prevented and the patient will have better effect. And please give it for minimum for 5 days to prevent the antibiotic resistance. 2050, all will be in trouble if you are alive because of the antibiotic resistance. Otherwise, there should be new molecule discovered. So then again, it's a tricky one. Okay, we all know that there's a fat soluble vitamin group, there's a water soluble vitamin group. Fat soluble vitamins are better absorbed and better utilized in the mnemonics. And water soluble vitamins are mainly used for the tissue repair, damage repair, mainly better absorbed and better utilized in the night. And we all know that this preparation now comes as a single preparation. So if you want to give 30 days to a patient where you need fat soluble as well as water soluble, what you're supposed to do is that 1 day morning you give, and second, third day evening you give. Alternatively, if you give, there will be better utility and absorption for fat soluble as well as water soluble vitamin. Please keep it in mind. The cases like oral submucous fibrosis, leukoplakia, all those disseminating disease cases, we are supposed to give antioxidants. Even if it is you have got a smoker's palate also, if you stop the habit, you give an antioxidant, things are going to be fine. If you are giving it for 30 days and all, please give it alternatively so that there's a better absorption and utility for fat soluble as well as water soluble. Now, please do understand this. Okay. It is a culmination of everything which we have discussed. Now, breakfast before 8 a.m., lunch between 1 to 2 p.m., and dinner must be before 8 p.m. And from 8 p.m. to 8 a.m., if you have fasting, definitely that increases your immunity, increases your digestion, and enhances your carbohydrate enzymes. The enzymes used for carbohydrate metabolism, liver enzymes, and enzymes produced by small intestines are enhanced. That lowers your blood cholesterol, lowers your blood sugar, and you will have enhanced liver activity also. That's why in Ramadan, that 12 hours fasting has been kept. So all the activity, immunity increases, blood sugar goes down, cholesterol goes down, and dehydrogenase activity also goes down. So damage is going to be really less, and you will have enhanced activity of all these enzymes. So that will give the resistance as well as the better health for the person. So breakfast between 7 to 8, lunch must be between 1 to 2, and dinner must be before 8. And I'm just going to talk about a misconception, because in the early morning, if the eyes are subjected to blue light, melanopsin produces. Melanopsin activates the entire body. So you don't need a bed coffee for the activation of the entire body. So that is a misconception actually, which has been followed for ages, for generations. That's why people take coffee. Actually, it is not required. The cortisol level drops by 10. If at all you need a motivation, it is by 10 a.m. You are supposed to take a coffee or tea. In future, as far as the chronic diseases are concerned, there won't be any pills or prescriptions. It will be implants. Implants are inserted into the body, and the drug will be released as per requirement. So we are just coming to the end of my topic. I'll just summarize once again. So if you should have a proper biological clock for the proper body functions. Seed givers are the factors which sets biological clock, and biological clock is usually set for the newborns. But please do understand, if we won't follow the rhythm, definitely our biological clock also can be altered. We discussed a case. So always make sure that we follow the proper biological clock. Second thing is that melanopsin, melatonin. Melanopsin, blue light morning, body activation. Melatonin, yellow light, night time. You need activation, you need depression, you need rest. 12 hours, definitely, which is needed for the proper body function. And if you use mobiles, please make sure that after 10 it is not used. And even if you have to use for an emergency purpose, please use it in high comfort zone as a power mode, so that the body is not subjected to the blue light. Then we discuss about the normal biological rhythms. We discuss about the disease rhythms and discuss about the corticosteroid therapy. I discussed about the systemic corticosteroid therapy. Topical doesn't matter. Systemic matters. If you have to give systemic, definitely please give it in the morning. If it is a short term, it's fine. Allergy, it's fine. But if you are going to give for a long time, like our pemphigus and all those autoimmune diseases, you are supposed to give as a single dose in the morning. Hypertension, you have got dippers and non-dippers. Dippers, please make sure that they are supposed to take only in the morning. They are not supposed to take in the night. And when you do in the surgery, you make sure that the BP is all right. They have taken the medicine in the morning. They are not supposed to take medicine in the night. Non-dippers, by like BD, they have to take the medicine. Diabetes, blood sugar peaks. Normal person's blood sugar peaks 3 times. That is 8 p.m., 8 a.m. and 2 p.m. So definitely we make sure that the food is taken much before that. And you have got Samyogi effect and dawn effect. Samyogi effect means those persons, the blood sugar level drops in the night. They are supposed to take a pre-bed carbohydrate snack, and dawn effect, they have to take BD. Anti-hyperglycemic has to be taken BD. And angina pectoris, we discussed, we have got vasospasm in the early morning, princemental angina. Then there is a variable and stable angina, which happens in the early morning. See, please make sure that your relative, your patient is susceptible to this. Please make sure that the drug is available in the blood during that time. So if the body's nitroglycerin are given, it must be given in the night. And if you're giving an aspirin or any anticoagulant, it must be given as a sustained release tablet, so that early mornings and maybe 2 a.m. to maybe 12 noon, it is available in the blood. Anti-hyperglycemic, hypercholesteremics, statins, night only. There is no point in taking in the morning. Even if you forget in the night, there is no point in taking in the morning. Please take in the night only. Asthmas and allergic rhinitis, early morning, 1 puff is enough. And allergic rhinitis, your normal tablets, you know that cetirizine is being used. You're supposed to take in the night, so that morning it has got effects. And the cancer has got 2 parts. One is the pain. Second is going to be chemotherapy. Pain means you have to give in the night opioids, and night chemotherapy also must be done in the night because of the excessive production of cancer cells in the night. Then gastritis. See, if you are giving ranitidine, you can give immediately. There's no problem. If you are giving pantoprazole or omeprazole, you have to give 1 to 2 hours before, so that it has got the effectivity. NSAIDs are better absorbed in the mornings. So chronic cases, for the better efficacy of the drug and to prevent other damages, you are supposed to give sustained release tablets in the morning till noon. Antibiotics, please use it responsibly. Correct dose, correct time, correct dose, correct duration. And definitely, if you need, as far as the dentist is concerned, if you have to mix an anaerobic antibiotic, please mix it. Vitamins, you have got 2, fat soluble, water soluble. So if you are going to give it for a long time, if it is a single combination, please alternatively you give. And please follow chrono diet. 8 a.m. before 7 to 8 breakfast, 1 to 2 lunch, and dinner must be before 8 p.m. So it's RDT means right choice, dose, frequency, and duration. And the timing is everything. Even if you spend the money, even if you do the correct treatment, if the timing is wrong, efficacy is not going to be there. So, thank you.
Thank you, Dr. Jiju. It has been a very wonderful presentation. It has been an eye-opener for all of us, and you have covered all the systemic factors also. So I think from tomorrow we'll be prescribing most of our drugs according to the time. So we'll take up some questions.
Please.
Participants, if you have any questions, you can directly ask, or you can post it in our chat group.
If you know we don't have any questions, we'll just go through this again, okay? Not the entire topic. This one. Okay. See, everybody must know this. So if somebody has not missed something like this, so please just go through it. The first thing, melanopsin. So metabolism is at its peaks, and there is a sharp rise in BP early morning. Peak hormonal level 7 to 9, and cortisol level, which is required for the normal body function. Sugar level also goes high. Less sensitivity to pain and less bleeding because of the vasoconstriction as well as a platelet aggregation. And because of all these factors, hormones, everything, we have got the highest alertness between 10 to 12. You take anything between 1 to 2, it will be digested. You take anything between 1 to 2, it will be digested. Normal persons I'm talking, not a diseased person. If you're a healthy, normal person, anything will be digested. And if it is possible, take a small nap. And 5 to 6, it is at right time for play. But practice, definitely it is not going to be possible. But make sure that your children are at least playing during that time. Melatonin, body is supposed to rest. Body is supposed to rest. And night, bowel movements, peristaltic movement, everything down. So whatever acid is produced in the night is going to remain there. So you'll have chronic gastritis, all the digestive issues in the future. Please make sure that you take dinner before that. And 2, supposed to be the deeper sleep. Somebody sleep at 10, 2 is going to be the deeper sleep. And the lungs are most active between 4 to 6. Lungs are most active between 4 to 6. That's why this yoga people say that you get up early in the morning, lungs are really active. You will be able to take maximum oxygen. So brain is going to be really active that time. That's why earlier used to say, like elders used to say that you get up early in the morning and study. Okay. Then again, disease rhythms, hypertension, epileptic seizures, stroke, and MI. Cortisol level, vasoconstriction, platelet aggregation, bleeding ulcer, chronic pain in the night, duodenal ulcer, we all discuss everything, and princemental angina. If your patient is prone to an attack, if the patient says that in between I get chest pain, all those stuff, please refer to a cardiologist and definitely tell the patient that you have to take the drug on time, which is prescribed by the cardiologist. Once in a blue moon, if you take, nothing is going to work out, especially the surgery, because nowadays impactions and every surgery happens in the night also. The patient may, it has happened to me, that's what I told. The patient says, doctor, I forgot to take in the morning, so can I take now? No. Sugar and hypertension, you have to really take care. Otherwise, you'll be in trouble.
So there is one doubt which has been asked by Dr. Divya. Right time to prescribe TCA would be night, sir. You can see that in the chat box, sir.
What is TCA?
That is what she's written here. Dr. Divya, if you are there.
Sir, sorry.
Tricyclic antidepressants.
Like amitriptyline and all.
Okay. See, when the epileptic seizures are going to happen, what time? See, the answer is here only. See, where if the epileptic seizures are really prone, antidepressants are one trace, you give for your seizures. So definitely epileptic seizures, the morning the patient is more prone. So the drug must be available. It should be either taken in the early morning or you can give it in the night. So drug must be available when the patient is most susceptible to the attack of epileptic seizures.
Okay, sir. Thank you. But sir, actually, it is being given for neuralgias, no, sir, like trigeminal neuralgia and all, which we now frequently see in our practice. So in that case, is it not feasible? I mean, it's we have seen that it's more good to give it in the night time. That's why I was just asking whether is there any...
You are right. You are right. I tell you. If you give in the night, it is available in the morning. So you know how to differentiate between trigeminal neuralgic pain and dental pain, because dental pain increases in the night, whereas neuralgic pain increases in the morning. That is the first differentiation. Other than the local factors, everything is there. If the neuralgic pain, if the patient is, we diagnose that way, it increases in the morning. Second thing is that it is going to be episodic. In between the episodes, it is going to be normal and it is not relieved by NSAIDs. And it mainly happens in the morning because all this vasoconstriction, everything, metabolism, brain activity, everything happens in the morning. So If drug is given in the evening, it is given as sustained release tablet so that it is available in the morning. That's all. See, trigeminal neuralgia, we give medicines in the mornings because it is the most, that time get the maximum attack of maybe like a sprout of pain in the morning.
Okay, thank you, sir. Thank you so much.
So, shall we conclude, sir?
Sir, thank you. I'll stop sharing.
Yeah.
I request our secretary.
Terry sir is coming with something.
Dr. Terry, a few words.
Excellent presentation. The daily practice nalla presentation, Arjit sir. Anyway, really thank you. It was a wonderful presentation.
Thank you, Dr. Terry. Now call upon our secretary, Dr. Pradeep Philip George, for the vote of thanks.
Respected President Dr. Murali Krishna, our distinguished speaker for tonight, Dr. George, all past presidents of IDA Malanadu, all senior members, colleagues at Anu Dental College, staff and students, and there are a lot more people. I can see almost, we had around 93 people in the Zoom, and we had around 20 people in the YouTube. So that is a record-breaking thing what IDA Malanadu has achieved today. Good evening to you all. To talk about the lecture today, I'm spellbound. I don't know what to say. I've seen him do this again and again, and all I have to say is, you sir, hats off to you, sir. You have done it again. Let me come to my duty of giving a thanks. First of all, to our president, Dr. Murali Krishna. I thank you, Dr. Murali, for taking the initiative and bringing up such a very interesting CD for our branch, also for all the people around here. Thank you, Dr. Murali.
That's very good.
To the distinguished speaker, Dr. George Baby, principal of our college where I'm also working, Anu Dental College. Sir has always been a motivator. You don't know how he inspires you. We at Anu does know that very well. And sir, again, you have inspired us to do even more better with your great presentation and very informative talk. Thank you, sir. And IDA Malanadu is always grateful to you. And we don't need to say, you are a past president of ours. So you are leading us from right from the front. Thank you, sir. Also, I thank all the past presidents, our senior members of IDA Malanadu, all the faculty and the students who have come from Anu Dental College, all the other participants who made this webinar a great success. Last but not the least, our CD chairperson, Dr. Ronan Sebastian. Just as always, he was a silent person who was doing the job. And the teasers which were there for this presentation, the hard work he has done. Ronan, you have done a wonderful job again. We are expecting more. Just like the last time I told, it is more and more of expectation what we have from you. Thank you. And I thank all the people who have come here again, once again. And thank you from the office of IDA Malanadu. Thank you.
Thank you, everyone. Thank you. Thank you, Dr. Pradeep.
Yeah. Good night, all. Good night.
Good night. Yeah.